Many types of natural calamities or man-made calamities can take place, and at this time, disaster management is the action which is implemented through proper planning, organized activity, and coordination. And through this disaster management, life of many people can be saved. So, let's know more about disaster management. Now, whenever any disaster takes place, so the disaster management, they see to it that they are able to prevent the loss. They are able to improve the tolerance of the people, those who have faced the disaster, in providing relief from the disaster, minimizing the intensity and extent of harm, preparation to face the disaster, immediate action in disaster situation, assessment of damages and intensity of the disaster, and rehabilitation and rebuilding the life of the people. All of these things are included in disaster management, and these actions are done through disaster management team. Now there are few basic principles which have to be followed by the first aid, and this has to be provided to the victims of disaster. Now this includes life and rescuation. Now rescuation is the action or process of reviving someone from unconsciousness or the apparent death. And for this, the principle we follow three things, that is A, B, C. Now A is for airway, B is for breathing, and C is for circulation, or you can also say as compression. Now during disaster, some people might face problem and they might have difficulty in breathing. So the first principle, that is airway, it should be done. In this, what is done is the person who is having problem with breathing, that person is held back, and the head should be held backwards in the sloping position, and the chin is raised up so that the respiratory passage which is there, it is open and the person is able to breathe properly. So this is the first principle, that is airway, so that we can immediate action can be taken on the breathing problem. Second is breathing. Now, if the person is not breathing, the breathing has stopped. So, this type of person should be given artificial ventilation by mouth to mouth resuscitation. You must have seen in many videos also, they give mouth to mouth resuscitation, that is, you're pumping air into that person's body. Next is circulation. Now this, if the victim is unconscious, at that time circulation is done. Now this is nothing but the CPR that is given. Now this happens after giving mouth to mouth respiration. Now the heart should be pressed down, and with both the palms it should be done properly, and it should be repeated at least 15 times. And this CPR, the full form of CPR is cardiopulmonary resuscitation, and it helps to bring the circulation which is stopped, and the circulation becomes normal after this. So these three principles can be used to given to the victims of the disaster, and this is the first aid which can be given at the lowest level before any type of medical help arises. Now during any type of disaster, if the person is injured, that the person is bleeding, if it's because of the accident, some fracture has taken place or burn, so some things should be followed, that is the first aid should be given to those kind of victims. Now the first aid which is given to the burns or bleeding victim is different from the first aid which is given to the victims, those who are not able to breathe or have suffered some stroke or trauma. So the first is bleeding. So if the victim is injured and is bleeding, so what we can do is we should cover the wound with an antiseptic pad. And if you don't have an antiseptic pad, what you can do is you can apply pressure to that particular area so that at least the wound can be stopped. And if it is a small cut and all, then we can apply the pressure for 5 minutes and so, and with our thumb or with our palm, so that the wound gets healed and the blood can be stopped from flowing. Now, fracture is the most common thing that can happen during any type of disaster, and that fracture can even affect the vertebral column or any part or the any bone. So, if any bone is fractured, it is essential that the fractured part is immobilized. Now, what do you mean by immobilized is that that part should not be moved. It should be arranged in the direction so that it is not moved here and there, so that is why that part should be immobilized. And now how you can immobilize it? It can be done with the help of any wooden rod which is available nearby, or a ruler, or anything which is hard and which is straight. Now, if there is an impact on the vertebral column, then the patient should be kept immobilized, and first the stretcher should be brought. And that also, when the person is being lifted, there are proper ways in which the person should be lifted and put on the stretcher. So these are the ways in which the first aid can be given to the fracture, and if the person is having impact on the vertebra. Next is burns. Now, if victim have burn injuries, so the best way what can person do is that hold the injured part under the clean and cold flowing water. Now, this should be hold for at least 10 minutes, so that the skin which has burned, the temperature can be adjusted to the normal temperature because of the cold water, and this way the consequences of the burns can be reduced. And after that, you can even cover the burn with a sterile bandage if the burn is not extreme, and if it is extreme, you should immediately consult to the doctor. Now, in any disaster or in any kind of accident, the care should be taken while transporting the patient, because if proper transportation is not done, then the harm could extend. So there are various methods which is followed. For example, the cradle method. In this method, the children and underweight victim can be carried, forming a cradle. Then we have a carrying piggyback method, in which the victim is carried on the back. Then we have human crunch method. So in this, if the one leg is injured, the victim should be supported with minimum load on the other leg. Then we also have pulling or lifting method. In this method, we carry the unconscious patient. Then we have carrying on four-hand chair. So two people, they form a chair so that the person can sit on it and the person is carried. We also have two-hand chair, so in which one person one two hands are given on the back and two hands on the lower part, so that they can be carried like a chair, and it is called as carrying on the two hand chair. And next is the stretcher. So if any emergency, so the stretcher is not available, so temporary stretchers can be made with a bamboo or a blanket. So these type of stretchers you must have seen in many movies also. So this is the stretcher method. So proper method should be followed for transporting the patient from one place to the other place, so that the affected part or the injury do not exceed.